Once again, we're back with Dr. Lasorsa, again with Citrus Hills Dental, and also joining us Judy Hitchcock, who has experienced the implant process that we're talking about today, and with great results. I got to say that. Again, she has a wonderful smile and has enjoyed the implants. How long have you had them now?
Well, we started this whole process almost a year ago, but I've had these teeth since before Thanksgiving. So I'm happy with them. Can't tell you. I eat corn on the cob. I eat apples. You know, things that I haven't eaten in years, I'm able to eat again.
You're able to enjoy a lot of things
all
today.
All kinds of things, yes.
As a result of that.
Yeah.
All right. Well, we talked about some of the examples that we have up here. We've got some more different things to talk about because, again, there's different situations for every patient that you see. So explain some of these differences here.
Well, again, it would determine what the patient needs, okay? If they're missing a single tooth and we have to, let me get this off. If they just need a single tooth replaced, we can put an implant there and a crown on it, and that will be a fixed option for one tooth. We can also, if they're missing a few teeth in a row, we can put a few implants together and make an implant supported bridge, which would be a few implants together, whether they be mini implants or this conventional standard size implants, and make a couple of crowns fused together, which is a bridge, and that would get cemented permanently as well. For the molar regions where there's a wider tooth and there's a lot more stress on our molars, I like to use a wider implant, more of a standard size implant. Those sometimes they can be done in one day, but generally we place them and let them heal for a little bit until we make the crowns on them.
Notice you kind of reverse the pin structure there. Instead of the pin coming from the bone into the tooth, now it comes from the tooth into the bone.
Right. Most standard size implants have three components to them. They'll have the implant, which shows here is under the bone. They'll have the abutment, which is what inserts into the implant. The implant is like a bucket, and the crown would be over the abutment. This is fused in one piece, but that's the idea, that the abutment would fit in and the crown would go over it. You can see this a little better in the front here. There's the abutment in the implant, and then the crown would go over the abutment. So there's three components to a standard implant, whereas the small diameter implants, they call them mini implants or one-piece implants. There's just two components. There's the implant, which is one piece, and then there's either the crown or the removable device that goes above them.
Okay. A couple more examples that you have over here for us.
These are more of the higher end models, and this is for somebody that wants something more than a denture. This one we call a hybrid. This is actually a porcelain bridge that is removable. It's not removable by the patient, it's only removable by a dentist, but we would put the same O-rings in this bridge so that it remains removable, but it's in pretty tight. The patient wouldn't usually be able to get it out by themselves. We would just take it off twice a year for cleanings, and then when we would inspect the O-rings and put it right back on.
Right.
But the difference between that one and this denture model is this is made out of porcelain, so there's no acrylic going all around like you see on the denture model.
Very interesting.
And this one, this is called our Cadillac, or this is called the roundhouse in the dental world. This is something fixed. This is a porcelain bridge also. Now I need a lot of implants to do this, but we can cement this on permanently. So this will restore your bite as natural as we can get it, and that would be cemented on permanently and doesn't get removed.
Okay. What's the biggest question that people have when they come in and start making these decisions about an implant?
Number one, they wonder if they're a candidate, if they have enough bone volume or bone quality to even do these options. A lot of people come in with an attitude that they don't think they're a candidate, or they're too old, or they can't afford it. So that's why I like to see everybody for their consultation first, to go over what options they'd be eligible for and what they'd like to do long term and what their budget would be.
And you make it easy for their budget too, I'm sure.
Yeah, we have financing options, so we can spread out the payments quite a bit so that it's affordable.
Okay. As you came in and started the process and you went through that 2 weeks and were making your decision, what were some of the questions that you had during that period?
probably my biggest thing. It's just gonna hurt. I'm a big baby when it comes to my teeth and you know, going to the dentist, obviously.
I think we all are, yeah.
Obviously. And that was my number one concern, I think, is it
I
gonna
do
hurt?
remember you asking me that a few times.
Several times.
But that apparently was not an issue.
No, in the long run, no. It's not totally painless, but it's over with so quickly, you know? And I would recommend anybody considering it, do it.
Talking about time frames now, and we understand you had extensive work that was done.
Yes.
Most people come in and they may have just some of this partial stuff done. Give us kind of a time frame on how that works.
If the teeth are already extracted and their bone is healed and healthy, we can go to work pretty much right away with whatever they're going to do, whether it's for a crown or a bridge or a denture or partial denture. If they have to have extractions done first, the grafting technique I use, we concentrate the patient's growth factors from their own blood. In other words, we have a phlebotomist come in and draw blood on them, and we put it in a centrifuge or a machine that will spin down the various factors in your blood. So we're using their own growth factors, their own cells, okay, their own stem cells, so to speak, to rebuild their bone. Now that process of grafting takes about 4 months to mature. So from the day we do the extraction and the grafting, for the bone to mature and solidify and turn over, it's about 4 months until I'll go back in to place the implant. And that's what Judy went through. She went through a 4-month waiting period in her temporary dentures until she, until she was ready for her implants.
There you go. Well, I wish we had more time, and I know folks out there have more questions, so they're invited to call you or stop in to Citrus Hills Dental and get those questions answered, okay? But again, we want to thank you for joining us back in the studio, Dr. LaSorsa.
Thank you very much,
and
Dennis.
Thanks for your great smile shared with us today,
Thank
Judy.
you.
Again, we so much appreciate you coming in and talking about your great experience with this. And thank you folks also for joining us on this edition of Citrus Today.